Welcome, everyone. Thanks for joining the March Healthcare Executive Group webinar series event. I'm Steve Sisko. I'm the digital content guy at the Healthcare Executive Group, and I'll be joined today by our Executive Director, Ferris Taylor. And we're going to be sharing some information on the Healthcare Executive Group's 2019 Top 10 list. We're going to provide some highlights of that list. Ferris is going to give some insight and color on the convergence and the divergence across HCEG's top 10 list over the years. We're also going to talk about the top 10 list as the basis for the industry pulse. We're going to give you some overview of the industry pulse, which was released earlier this week. That's the 9th annual industry pulse report. And we're going to share a little bit more about HCEG and the industry pulse going forward. Real quick on the housekeeping is we will share all these slides with the registrants. We'll email them to you. I think they're also available for download in your panel there. And we're going to have a question and answer period at the end. So feel free to submit your questions via the chat window. You can also email them to info@hceg.org, or you can also tweet at us on HC Exec Group. So without any more from me, Ferris Taylor will say hey and share some overview of the Healthcare Executive Group and our top 10 list. Ferris?
Steve, thank you for coordinating and kicking off this webinar on the HCG Top 10. As you noted, this is our 31st year in business. We were founded in Boston in the mid-1980s when Digital Equipment, DEC, one of the many computer manufacturers at the time, disbanded their healthcare users group. And that group of executives then and still now found professional and personal and organizational value in having a group that they could share healthcare challenges and opportunities and solutions with, and do that in a closely connected and trusted environment. Interestingly enough, about 10 years ago, our group realized that we could facilitate broader industry-wide discussion if we more formally created and then published kind of a David Letterman top 10 list of what our member plans and executives see as the critical issues. And that list now is the core of what we do through our monthly webinars, through our newsletters, through executive roundtables, white papers, blogs, Steve, that you handle for us, and that top 10 list also drives the agenda for our annual meeting, which we'll hold this year in back home in Boston, where Digital Equipment was based. You can always find more about HCG on the hceg.org website, so I won't go into more detail there. But that's the background of HCG.
All right. Well, thanks, Ferris. Yeah, the process for identifying and ranking the Healthcare Executive Group's top 10 list was actually interesting in that it includes the perspective of a variety of different stakeholders. It also includes some group discussion and several iterations. So real quickly, we have this slide here where basically at a high level, we identify about 50 challenges, issues, and opportunities facing healthcare execs. And then those are culled down to a smaller list by board members and associates. And then that list is presented at our annual forum. There's been an overview provided, and then they have roundtables and networking discussions on those items over lunch. And then that list from all those different tables and people is compiled to about the top 10 or 12 items. And then those items are posted in a random order in a tool that we use. I believe it's Qualtrics. And the members actually rank the top 10 items, and that the results of that become our top 10 list. So it's a very democratic and group process, so it's interesting in that regard. So Ferris, can you provide a little bit of overview on the 2019 top 10 list?
And clearly, Steve, thank you. There's a lot of detail here and even more background on each of these items that you see on the screen for our 2019 list. But so that we're all on the same page, I'll shed just a little bit of light on each one, and then we'll come back and go into more detail around them. But, you know, at the top of the list is data and analytics. Last year, it was there with a qualifier of clinical data, the things that are necessary to manage health and support decisions across healthcare. Of course, consumerism and total consumer health is number 2 on the list, and that's the broad definition of improving consumer health and well-being. A few years ago, population health, what we now call in the industry social determinants of health, came onto the list in a major way, and that's specifically for 2019. It's recognizing the organizational efforts necessary to better address what one of our board members started calling, and we've adopted, the barriers to health. Number 4 is value-based payments. We'll come back and talk about that in detail, but it's that transition that we're going through from fee-for-service to a more value-based payment system that focuses on lower costs and improved quality of care. Any list would be remiss this time at this age in healthcare if it didn't recognize the digital health revolution that's taking place. And that's everything from patient portals to cost transparency tools, digital payments, all of the wearables that are out there. What consumers really experience in other aspects of their life, getting those experiences embedded into healthcare.
So
We've
Ferris,
heard a lot in numbers. Sure,
I'm sorry.
Steve.
Yeah, I'm sorry to interrupt, but this number 5, the digital healthcare organization that you just mentioned. Now, to be clear, we're talking about all organizations, you know, health plans, health systems, providers, I guess really even patients and consumers. Is that correct?
That is absolutely correct. And we're seeing more and more in the practice setting, whether it's telehealth or it's a physician practicing in the office, the tools, the digital technology that surrounds them now has changed dramatically. When I first mentioned it, Steve, I was focusing on the consumer side, but even when we talk about consumers and all of the wearables that they have out there and all the medical device issues, there's still an information flow and a challenge that digital health organizations have. So thank you for the question and the clarification. Rising pharmaceutical costs are everywhere in the news right now. I really say number 6 is not, it's focused on pharmaceutical costs, but it's really cost transparency. It's the big issue of how we address healthcare costs. We'll come back and talk about number 7. It's new to the list this year in terms of external market disruption. And that's new players outside of the traditional stakeholders and what it means for healthcare. You know, Amazon and their new team, but more importantly, an Apple or a Walmart or Microsoft, Google, Facebook, new players looking at healthcare and saying, we want to be part of this system. For many years, administrative efficiency has been on the list. This year, it got much more specific about operational effectiveness, the programs and processes, including new business models, to really bring healthcare into a real-time 21st century environment. Any list would be remiss this year without addressing the opioid crisis that we're addressing. For the Healthcare Executive Group, those discussions were really identifying, supporting individuals and populations struggling with substance abuse and addiction. And last on our list, and we'll come back and talk about it as well, privacy and security, really cybersecurity, protecting the privacy of patient and consumer information and maintaining consumer trust that's there. We'll discuss a lot of this, not just on this webinar, but throughout the year. But that's the focus for HCEG for 2019. And as we compare what our members voted at the end of our annual forum last fall to other lists around the industry, it is a good set of priority topics for all of us. And our executives use that list within their own organizations to develop more robust and effective strategic programs. We share it with you on the webinar today and with the rest of the industry to engage deeper and more constructive discussion.
All right, that sounds good. So Ferris, you just reviewed the current 2019 top 10 list from the Healthcare Executive Group. Can you provide some insight as to how items on this list, the newer ones, the ones that have been on the list for a year, and then those that have dropped off, can you provide a little insight on that?
I'd be glad to, Steve. And one of the unique aspects of the HCEG Top 10 is that we do go through this process that you described to create this list every year. And I'm finding now, because we published it 10 or 12 years, that being able to look back actually helps us look forward to what's happening in the industry and have a better sense of what's changing in the industry over time. It's a very valuable tool to us as an organization and to our member health plans and provider groups to highlight the struggles and successes. And as you and I have talked about this, there's three that are relatively new this year. I mentioned the issue around external market disruption, and that is a new issue. It isn't that healthcare has been very responsive to disruption as an industry. I worked years ago with Clayton Christensen as he published his book, The Innovator's Prescription, and he is the author of Disruptive Innovation. I'm not sure it will play out in healthcare exactly the same way, but it is a message to us that if we don't change, there may be external factors that will create that change. Operational effectiveness is new on 2019's list. For a number of years, administrative expenses, 4 or 5 years, it was a key component of the HCEG Top 10. Then the ACA came along, and all of the systems and infrastructure for individual enrollment and health benefits that had to be standardized took over. We're coming back to new technologies for operational effectiveness. And I mentioned opioid management, a real crisis that we face as an industry. And I was pleased to see our member plans actually bringing that to the top of the list. And thank you for the transition to frequent issues. Data and analytics for probably our entire history has been at the top of our list. It's what makes the merry-go-round go round in healthcare, and critical to the future of healthcare. The transition from employers and the government being the buyer of healthcare to some future where the consumers are that primary decision maker, and they really are now. Great progress has been made on consumerism. We're still in the throes of payment reform, but as you look back over healthcare and the politics and the technologies of healthcare, of course, getting to a value-based type of relationship as opposed to a pay-for-volume relationship that's been on our list every year for the last 10 years. Aligned with consumerism, number 2 this year is that digital health organization, the digital consumer, and as your question pointed out, Steve, what that relates to the other stakeholders, health plans with respect to patient portals and transparency, providers with respect to all of the information they could have at their fingertips to better provide care to their members. So those are the frequent items that we see quite often.
So you provide a lot of information there, and including what's new on the list and what's been a recurring item on the list. And I'm looking at cybersecurity down there. It just made the list as number 10. Any commentary on items that barely made the list or that dropped off? We've got this convergence and divergence, and I know we've got some information coming up to give a view of the top 10 over the last decade. But before we leave this slide here, any commentary in that regard, or I guess you'll address it in the next slide?
Well, I can, it isn't just a list. It starts with a large number of issues that we accumulate during the year. We'll talk about open-ended questions and industry pulse that tell us what might not be on our voting list. But looking back over time, it is a challenge. Cybersecurity is an interesting one. It was clear at the bottom of our discussion topics going back 10, 12 years ago. Really came to the top of the list 3 or 4 years ago when, in very quick order, we had a couple or three major industry breaches affecting something like 100 million member records that were lost into the dark side of healthcare. But I think it's a bigger issue than just privacy and security. I think it's at the heart of our trust relationship with consumers. If they can't trust sharing their data with us, then we won't have that data. And if we don't have that data, we won't move into the 21st century. There's some very interesting insights coming from our discussions, our notes on the HCEG Top 10, but it's really highlighted in the last couple of years with a report that we published with Change Healthcare, one of our sponsors, called Industry Pulse. And if you haven't seen that, I refer you to it. But we asked this year, what's holding us back? And 40% of the responders, it was shocking to me, said the sophistication of cybersecurity attacks are increasing at a higher rate than our prevention capabilities. And I don't know if that will cause us to stall and say it's a battle we can't win. I certainly hope that we don't take that position, but resources are tight. Getting money to step ahead in cybersecurity is a really big problem. There are too many urgent priorities, and it's impeding our ability to efficiently and effectively move forward if we don't address cybersecurity.
Mm-hmm. So, looking at this list of the top 10 over the years, we can see, as you mentioned, the items that are recurring, payment reform and analytics, consumerism, and then some of the less frequent items that have come and gone, like, the ACA implementation we could see here was big in 2014 and 2015, and it's sort of gone away. The idea of the healthcare reform has cooled off a little bit, maybe not. And then things like genomics and opioid, which is a new item, as you mentioned, this year. So some of these are less frequent, or they're developing. Any commentary on these items that maybe why they're showing up now, or why they haven't been in the past, in that regard? I don't know if that made sense. Go ahead.
It does, Steve, and we could spend 2 or 3 hours looking longitudinally across the dynamics of the industry. I really do think, and you can see that we can't take just a specific set of verbiage around what's on a top 10 list in any one year. We've had to step a little bit deeper and look at grouping those into various categories of issues. Healthcare reform or regulation, has had a different descriptor on it at different times over the last 10 or 12 years that we published this list. But in fact, the most prevalent and pressing issue over the entire time has been this concept of payment reform. I think embedded in that is the challenge around the ever-increasing cost of healthcare and the issues that we face with respect to the cost. We just have not been able, like other industries have, to be able over time to see quality of products or services increase and at the same time see the costs go down. Instead, in healthcare, we do see significant increases in quality and outcome, but the costs continue to go up as well. And that's a cycle that absolutely is begging for a solution. So that's a frequent issue. Naturally, to address any of these, as I mentioned earlier, the data and the analytics and the new dimensions of data and analytics. And what I'll add there, I mentioned clinical data. The data that we had to analyze 10 years ago was primarily administrative data, claims data, and prices and like that. But now we're looking at lab data and other sources of clinical data that will have a big impact. More importantly, we're starting to look at the whole person, what we identify on the top 10 as that social determinants of health and its implications. Naturally, you have listed here consumerism and the fact that the consumer themselves really don't want to have healthcare front and present in front of them every moment of the day. We want to engage consumers. They want to get on with their life flow. They have families, they have jobs, they have communities, they have networks that they want to be involved with. And consumerism is that big umbrella of how do we make this just flow for them, again, in an efficient and effective way. Other topics here we can come back to.
Yep.
Some are down on the list, but equally as important.
So this top 10 list over the years have driven a lot of, really all of the programming and content development and the themes for our various in live events. How else is the top 10 list used, and specifically in regards to the Industry Pulse report? Please provide a little bit of color on that, Ferris.
Yeah, several. It's an annual process, Steve. You described the creation of the HCEG process in terms of coming to its fulfillment at the end of our annual meeting with the publication of a top 10 list. But really, we begin that process the prior year by looking at open-ended comments and insights from the previous year's Industry Pulse and add things to the voting list. But we go out to the marketplace, and this happened a few years ago, where we said our members aren't necessarily a random sample of the industry. It's naturally evolved, and I won't go into the details, but the healthcare executive group member organizations are 30 or 40 healthcare stakeholder groups that are more the mid-sized regional organizations. Those executives take a broader and less siloed view of issues. But we wanted to go out to the industry and say, well, what does the rest of the country think about the top 10? So Industry Pulse is a national validation and alignment and also alert as to what we may have missed on the top 10, but it's also a tool that allows us to dig more deeply into 3 or 4 of those issues and really ask what and why and what needs to change and what might be different in the future for those top 10 issues. So we use the annual meeting as kind of a focus group to actually script the survey for Industry Pulse. It then goes to the field at the close of the year, November, December, and then we have a couple of months of analysis of that data. It's very comprehensive and detailed. And then with Change Healthcare, we published this year the 9th annual Industry Pulse survey or report. And we'll talk more about that, Steve. But that's the process. It becomes a tool not just for our members, but by doing Industry Pulse, it's really a statement to the entire industry of priorities and information that can be used strategically and operationally in their organization.
And these organizations are really a cross section of all the players in the healthcare space. Not just the health plans, but the health systems and the provider organizations, whether they're bearing risk or not, and then all of the new We have non-medical service providers now. We have these third-party new market entrants, the Ubers and the great calls of the world. So, attendees of today's webinar will definitely want to download the Industry Pulse report. And, for instance, we've got a couple of slides here showing some of the samples of the type of information you're going to get from this document. It's available for download, and we'll have that link, and we'll be sure to share that with all attendees. But you can see here that various of their survey questions are based on certain items. So we see some questions about, top 10 item number 2, which is total consumer health, and number 4, the value-based payments. We also have, there's dozens of slides in the actual industry report. This is just a sample. And also surveying people's ideas about external market disruption and, this cybersecurity issue that's barely hanging on, but apparently very important. And then also we have comments. There's a lot of comments and quotes from various survey respondents. And Ferris, if you have any comments on these comments, feel free to share them now, and then we're going to get into some Q&A.
I appreciate that, Steve, and you did highlight 3 or 4, and there's a lot of depth in the detail in the responses to those. The white paper, the report itself, of course, can't cover all of that. Throughout the coming year, it will be highlighted, as you said, in a webinar, in CIO CTO track that we're doing at World Healthcare Congress, at Health.co coming up next fall, and all of that. A couple of 3 things that jump out at me, and this is unique to Industry Pulse. A lot of our questions have open-ended response, and on some of the questions, we had 600 or 700 different comments coming back. So when you say culled responses, it really is that. But interestingly, as we look at external disruption, somebody saying chaos and knee-jerk reactions to new entrants, a caution that it's a complex industry. We need to be sensitive to that. Start focusing on patients. It's always an enigma to me that something happens when we as healthcare executives walk in the front door of the building. We take off our hat as a consumer and put on our hat as an executive. And we tend to forget what it's like to be a consumer or a patient in healthcare. And I think more than anything, we're all consumers of the products that we're supporting and services. Put back that on that consumer hat and say, what does it mean? You noticed in my bio, the last 5 years, I was Chief Strategy and Chief Operating Officer of one of the failed attempts with a co-op to build a health plan from scratch. But in fact, when your board of directors and as a co-op, our board members were all members of our health plan and consumers. When your boss is your customer, you behave very differently. That is desperately needed. So each of these we could talk about, the challenge of retaining and building membership with an unsatisfied consumer landscape. Those are all great quotes, and there are, like you said, dozens of them in the report, and we will talk more about them in the webinar coming up.
All right, yeah, that's great. This upcoming webinar on April 18th, which is a webinar dedicated to a deeper dive into the Industry Pulse. So we're sort of winding up on time here, and we actually do have 2 questions. And actually, if anyone has any other questions, go ahead, submit them in the chat window. And you can also send us any questions or comments, after, if you've got something that you'd like to ask specific to the top 10 of the Industry Pulse, excuse me. Feel free to submit to these email and Twitter account or chat window. So, okay, the one question we have here, Ferris, is your top 10 doesn't always or seem to track items included on some of the other lists of top ranked healthcare challenges and opportunities? I guess they're talking about, every year we get our, our trends and analysis and things like that. Why do you think this might be the case? So what would be some of the reasons why the items on our list might not correlate or directly track to what some of these other industry research outfits are coming up with?
Wow. Very, very good question. And we really do appreciate the questions because it's self-reflecting on us as well. But, one of the differences, Steve, is that this top 10 list is created through extensive discussions over a year process. And so it's actual payers and providers and technology vendors that create the list. So it starts very differently. The second reason is that it gets validated and then researched through industry pulse. So the first thing I would say, it isn't Steve Sisko's list and it isn't Ferris Taylor's list. It isn't any specific organization promoting their own agenda. This is the industry's list. And so it's without any self-serving attention or priority. We do track all of those lists and we add them to the things that we put in front of our members. And we cut it off at 10. We could have a very different list, but in fact the top 10 is where we cut it off. And so it's without being critical of every other list, it's unique and it's focused on action and strategy that all stakeholders in healthcare need to focus on.
Okay. All right. Well, great. Thanks for that. So, and there's another one here. So, why has value-based payment been on your list almost every year, yet respondents still feel widespread adoption of upside downside risk is still 3 to 5 years off? I don't know if we even mentioned that it's off 3 to 5 years, but this person must have been reading one of these recent, again, I mentioned how the industry pulse came out Monday, and the media and journalists, reporters have picked up on this. And I know that two of the articles I saw were talking about value-based reimbursement being around for years now, and it's still 3 to 5 years off. Any commentary on that, why that might be?
And we have had in the past an entire 3-hour executive roundtable sitting in a circle, really trying to digest this. I would also say, and I hope it's on our HCEG website and it's probably on Change's website, we did 3 or 4 questions last year on value-based reimbursement. And it may be, Steve, that the person asking that question has been tracking this even from last year, the 8th annual Industry Pulse report. But I think at the heart, everybody agrees, payers, providers, consumers, that we need to make this transition to value-based reimbursement. But there's some fundamental things that we got to put in place before we can ever move it forward. And they're still being defined. Last year's Industry Pulse asked specifically, what are the primary barriers? And I just flipped to it as you asked the question. The number one barrier was the complexity of changing physician behavior. I mean, if you're a physician and you have dozens of patients out in your waiting room and you're trying to catch up, and now I have to think differently about how I interact. So there is an operational aspect of this, but there's also confusion around the payment models. And you mentioned upside risk and downside risk and shared risk and pay for performance. And we haven't settled on that model. The fee-for-service model is very ingrained, and it took us 40 years to put it in place. It's taken us time to get it out. But I think more fundamentally, as I listen to our members, we haven't defined a measurement of outcome. CMS for Medicare put in place the non-event, that if there's a hospital readmission within 30 days, we're not going to reimburse for that outcome. That's an outcome type of measure. But is 30 days the right length of time? if you have open heart surgery, 30 days, you're barely starting to recover. We've also seen statistics that just the common human nature to look at the rules of the game and define them differently. The readmission rates in day 31 through 35 or 40 then go up significantly. Gosh, if I'm not going to get reimbursed, I'm going to put that readmission off for a few days if I can. I hate to say it that way, but we need to have trust and confidence in the measurement.
Mm-hmm.
And then, Steve, we don't have systems to actually track the outcomes that we want to define as effective outcomes. So there's still a lot of work to get to value-based reimbursement. So your question that was asked, I wasn't shocked at the response that we're still 3-5+ years out. 64% of the responders said it was more than 3 years out before we would get to value-based reimbursement. Right. Excellent question.
All right. Okay. Well, we're nearing the end of our time here, and we did get one more question in. And of course, if you could submit some more, we'll be sure to answer those and include them in our recap here that we'll mail out to all the registrants. And so let's see what's next. So I think we've got a couple of things we'd like to share that are we believe good opportunities to learn more about what's happening in the healthcare industry from the perspective of the executives and the leaders that are doing that. We're going to have a Industry Pulse survey readout on April 18th at 11 a.m. Pacific time, and we're going to provide some additional analysis and insight on that, and actually give some specific ideas on how these leaders are preparing for the future. So we have a link for that, and we'll provide that in the package. And let's see, what else do we have here? We've also, Ferris, would you like to share this information on this track that we're partnering with the World Healthcare Congress on?
Well, thank you, Steve. And this is a strategic direction we got from our board of directors 18 months ago. HCG does not aspire to be a HIMSS with 45,000 attendees, or even an AHIP with hundreds, or World Healthcare Congress with 1,500 attendees. So we conscientiously have gone out to partner with other healthcare organizations that align with the mission that we have to change and move healthcare forward. World Healthcare Congress came back to us last year and said, would you help us put together a CIO, CTO strategy track within their Congress? And there's 8 or 10 tracks. I will be chairing, and HCG will be providing a lot of the thought leadership, and the topics for those sessions actually come from the HCG Top 10. So I can say this is kind of a mid-year annual forum for those interested in the HCG Top 10. It is a specific track, but is supported with some great general sessions and really top-notch speakers. I would also say, and it's here on the screen, there's an HCG 2019 code, discount code, and I have inside information that code is multiple times, 3 or 4 times greater discount code than you'll see elsewhere in the industry. So use that code, register. I would also say that there's a workshop on Sunday that is a separate $400 registration. Dr. Sunny Giles will be previewing in a workshop her book on the new science of radical innovation, and healthcare is in dire need of radical innovation. If you email us after you register using our discount code, and go ahead and register for that workshop, if you email us or go to info@healthcarehcg.org, we have an arrangement with World Healthcare Congress where we'll waive that registration fee. So that's an additional $400 incentive to come.
All right. Well, we'll include information on that in our email that we'll send out to all the registrants. So actually, wrapping this up, we would like to thank our sponsors who help enable our organization and support our members and associates. And you can engage year-round with HCEG and other members. We have organizational and also a new individual membership option available, $149, and you get quite a bit of information and importantly, networking and other opportunities there. So also like to thank everyone for attending today's webinar series event, and thank Ferris, for your leadership and insight, and not just in today's webinar, but throughout the year. And I guess, Ferris, with that said, if you'd like to take us out on this, we can call it a wrap.
Just to thank you, Steve, just a thank you to everybody participating on the webinar or who might be hearing the webinar after we rebroadcast it with the recording and like that. I also, to echo what you did, want to thank the 10 sponsors that HCEG has. We have a unique relationship with those sponsors. It's an annual relationship. It's not an event relationship. And they participate in everything we do throughout the year in a thought leadership way. They bring the best of what they're hearing and the best solutions that they have to the table. And then with each of you listening to this webinar and all of our members in all of our events, we actually roll up our sleeves and go to work to try to address the opportunities that are ahead of us in healthcare. It's a big challenge. Michael Crichton in Lost World said extinction's the inevitable result of one of two things: too much change or not enough change. We're in this not to be a dinosaur, but to actually survive and thrive as healthcare goes forward. And we appreciate you joining us in that endeavor. Thanks, and have a good day.
Yeah, y'all take care. Look for your email with a summary of everything we've talked about today. Thank you.
Thanks.